All right. Before Emma Ingena home, Akwaba, we want to welcome everybody to today's edition of Health Emphasis Week. Now, actually, no, but I didn't say a percent camp within one seminar, and then your customer for community obedi anim ewo adehyeamu na wakyerɛkyerɛ yɛn sɛnea ɛbɛyɛ bɛti abɔ yɛn ho ban na yɛtumi ahwɛ apɔmuden ho nsɛm so yie na ansa na ɛbɛyi na kyerɛ na sɛ yɛbɛkɔ so na ɛbɛhyɛ aseɛ with our opening hymn yɛwia na yɛasrɛ ama Elder Ajiman no wabɔ mpaeɛ opening prayer na ma after our opening hymn no na afei yɛyi ɔkasamafoɔ no ahwɛ nti yɛnkyerɛ ho no yɛbɛtie yɛn opening hymn no first.
Teach me Recording in progress.
Elder Ajiman also about your opening prayer no amaye Madarama.
So my mom prayer. Also, Henry, there was and you marine so about him. The bassy about some import say him for 10 or friends here, ma. Now the ember already what do I think we and you marry was some of us here, they my empty. Yes, so some adrum chronos, a mechanic. So by a venya some rain near the tea. Aqua was sitting over because I train you right next one such council. One cassa wakasa after me. Na fe ade adwen sakra ene sae aba wo wasafo mu made yetie ne biara no yenim sa ho baba yamfaso bu se brade wasisi de amaye ene mre nso so no sa esi ai beka sa enye pi se akwa brade fie yede wase se wura otie wa wada roma ene wo wadum ntino made ye be sai enro wa hinwa no nim na enye sa de opeda. Amen.
Amen. All right. Thank you, Elder, for the wonderful prayer. At this point, I will ask Dr. Heather to do the introduction for our speaker for today. Okay.
Hi, good evening, everyone. Thank you so much for joining for another day in our Pediatric Health Emphasis Week. The person who will be presenting today, I have been honored to know her. I met her through a former classmate, Dr. Ochier, which you all I know are our Prince's wife, Beryl Ochier. So Dr. Beryl Ochier, she has a passion for dentistry, and her journey began when she completed her bachelor's in biology from the University of Texas at Arlington. She then went on to complete her doctorate in dental surgery from the University of Texas Health Science Center School of Dentistry in Houston. She currently works in private practice in San Antonio, Texas as a general dentist. And I knowing Beryl, even though I do not live in the same state as her, from the brief time that we got to spend time together, she is a down-to-earth individual, an extremely intelligent being, but at the same time, someone who you can talk to and not be afraid of. And, you know, she balanced out her intellect by also being, she didn't tell me this in her little biography, but you will also see her doing different forms of lifestyle on media for those who are on social platforms like Instagram and elsewise. But this is just to let you know that this is a woman that's coming to you with real relevant facts that are practical, but as well as theoretical from her studies. So I invite you all to please stay tuned to none other than Dr. Beryl Ochier.
Thank you so much, Heather. And thank you all for inviting me to join. This evening, I'll be talking about dental health, but I'm talking about pediatric dental health specifically, since I know that's the emphasis this week. So I'm excited to share with you about that. I'm going to try to share my PowerPoint with you all, and that way I can, let's see. Okay. Thumbs up if you're seeing my slides and me. Okay. So as Heather mentioned, I am a general dentist. I'm passionate about teeth. I'm a general, so I do a little bit of everything. I do see kids, I do pediatric, but I also see adults. But I love to talk on this, especially as a mom of 2 young kids. Like she said, there's some practical part to it as well, because I've learned the things in theory and now I'm applying them. So as she said, my name is Dr. Bear Otri. I'm a general dentist, originally from Dallas. And I went to dental school in Houston, but we currently live in San Antonio. As she mentioned, Dr. Prince is my husband. You all know him because he used to fellowship with you. So today I'm going to be talking about pediatric dental health. And I have this quote to share. Use the smile to change the world. Don't let the world change your smile. So we're going to talk about the importance of your smile, the importance of your teeth to your overall health, but your overall confidence and just quality of life. I'm going to try to convince you this evening of why teeth are so important. Specifically, primary teeth. So primary teeth is another way of saying baby teeth. As we all know, you do get 2 sets of teeth. You have an initial set that comes during childhood, and you gradually develop your adult set. And many would ask, why are these teeth important? You will lose them. We're going to talk a lot more about why they are important, why they are necessary, and why God designed us this way. So I have several reasons listed, and I'm just going to talk about them kind of briefly, one by one. The importance of primary teeth. Number 1 is mastication or chewing. So digestion does begin in the mouth, and the way to actually begin that process is mechanically breaking down your food. The only way to do that is with your teeth. And so that's very important, because if there are any issues with your teeth, even baby teeth, it will affect your nutrition, because you might not be able to digest your food correctly initially in the oral cavity. And as we know, children start eating around 6 months of age. Guess what? Teeth start to erupt into the mouth around 6 months of age. God did that on purpose. So hand in hand, you start getting teeth, you start consuming solid food. Obviously, baby food, table food, onward to where your child is eating what the family eats. But this is so important, because if there are issues with the teeth, if they're not coming in on time, then you're not going to be able to develop your mastication. You're not going to be able to gradually eat more solid food. Number 2 is speech. Speech is very important, because you definitely need your teeth to form speech sounds. Again, you're gradually developing teeth from the age of 6 months to 3 years. When are you learning how to talk? When are you saying your first words? 6 months to 3 years. At what age are you having full-on conversation? More so around age 3. Age 3 is also where you have your full set of primary teeth. So that makes baby teeth so important. Not present, if they are breaking down, if they are not in the right position, it could affect your speech. Third reason, aesthetics, or what I would say here would be beauty. We all have a smile and we all want to show our smile. But if there are certain issues with our smile, again, broken teeth, cavities, infection, other issues, it may affect your confidence. This goes for adults, but it also goes for children. It's very important that children are confident and happy with their teeth. This is not to say that maybe the way your teeth come in as far as the arrangement, but I'm talking about the overall health of your teeth. Because say something happens and you lose a tooth early, it could affect your confidence, especially if it was a front tooth and you don't have the adult tooth coming in yet. So far what I've said is that baby teeth are important because they help you to chew, they help you to produce speech, and they help have an aesthetic or able to have confidence in your smile. The next one I want to talk about is that they hold the place for the adult teeth. So as we'll discuss, each baby tooth comes one by one from age 6 months to 3 years. And then starting at 6 years, you start to get your adult teeth. But there's a process there. So if you lose them early or if something happens to them early, it kind of throws everything out of whack. So they need to stay in your mouth until the right age. And then from 6 years all the way to about 12 years, you'll be getting the adult teeth. So it's actually really important that everything happens on time. And that's what makes baby teeth important. You don't want to neglect them. You don't want to say, oh, it's just a baby tooth. I don't have to brush it. The kids can eat whatever, because they're holding that place. My next reason, development of your craniofacial system. So that's a fancy way of saying that the baby teeth are actually going to help your entire head and neck to develop, because the position and the presence of the teeth helps give the jaw the right signal to grow. Obviously, if you're going from a newborn to a 12-year-old, the head is going to grow a lot, right? So the jaw is going to grow. And part of that jaw growth is having the teeth in the right position. So again, when we have teeth missing or teeth ill position, it can affect that. The very last thing, and I would argue possibly one of the most important parts of your primary teeth, is habits for permanent teeth. So I want to give an example. So why does it matter the habits that we develop as children? Because guess what? We'll grow up one day, we can just develop new habits. Why does it matter that we teach our kids how to pray or how to be involved at church? Why does it matter that we teach our kids take care of your money when they only have $1? Because the habits you start young take you through life. Some habits people start in childhood may potentially become adult habits. So dental health, I see it all the time. I see patients who are like, well, my parents never cared about my teeth. My parents told me you brush when you want. My parents were not concerned. I never went to the dentist. And they've carried that on throughout life. So this is so important. From age 6 months, when the teeth come in, your children have to understand these teeth are important. I want to take care of them. It's not something optional. It's something that I do. Just like I shower every day, I have to brush my teeth every day. Why? Because God has given me these teeth. And if I lose them, if I break them, if I ruin them, at some point, I can only do so much to replace them. A dentist has to intervene, but there's only so much we can do. So I speak with passion, which most lay people probably would not have on this topic, but I'm passionate because people feel like, oh, they're baby teeth. It doesn't matter. They're actually very important because the habits you build now are the habits that will carry you onward. And it's really going to be important going forward. So I mentioned that you have these baby teeth, and this, I won't go into detail, but this just shows you that there is a specific stage of time for each tooth to come into the mouth. So if you've seen a little newborn baby, not newborn, you've seen a little baby who's like 6 months, where do you normally see teeth? Well, you see like 2 little teeth here on the bottom, 2 in the front, on the top. So that is the sequence. So starting at 6 months, you get those 2 on the bottom. So you see like a 1-year-old, they may have like 4 on bottom, 4 on top. You see a 2-year-old, they may have more in the back, all the way up to 33 months, which is just about 3 years. So, anywhere in that time, you're going to see that sequence, and that's how they're going to erupt. And there's also an eruption sequence for the adult teeth, and it involves gradually losing these teeth one by one. So you wouldn't want to just lose a bunch of these teeth at once, because then you will be missing teeth for a long time. There's a specific stage where each tooth comes in, and each tooth serves a specific function. So if you're missing them too early, that would be a problem. So first thing I want to talk about is, how do we take care of our teeth? How do we take care of our children's teeth, since we're talking about kids? So as we all know, toothbrushing is the #1 dental hygiene thing to do. So when it comes to kids, though, you want to look at the amount of toothpaste quite carefully, because we don't want to overload them with the fluoride. Fluoride is very good, and we will talk more about fluoride, but there's a reason for this. So if you look at the bottom picture, it has a picture of what's considered a smear, what's considered a pea size, and what's considered regular. So baby is 6 months old. They get their first teeth in their mouth. You want to use a smear of toothpaste. You want to use a smear, which is barely any at all. It's because there's barely any teeth. So smear of toothpaste twice a day for 2 minutes. Rule of 2, twice a day for 2 minutes. Now I have to give the caveat that obviously if there's only a couple teeth in the mouth, it doesn't have to be that full 2 minutes. But as we're getting towards age 2, where you have 20 teeth, 2 to 3, then you want to move toward that 2-minute mark. So smear of toothpaste, 2 minutes. That's for, a young infant. As they reach around the toddler age, 1 to 2, getting into anywhere from 1 to 3, you can start gradually going to a pea size, which is still very small, but more than the smear. And then the regular is for our older kids, like, 4, 5, 6, have a full mouth of teeth, starting to even get adult teeth. That's when we're moving to the regular. So if that makes sense, smear is more for the infant, pea is for the toddler, regular is for the young kids, older toddlers. It's not strict, but this is just to control the fluoride exposure, because toothpaste has fluoride. And let me just explain. Fluoride is a chemical component. It's a mineral. It's a vitamin, if you will, that has been found to be extremely beneficial for teeth. So fluoride actually strengthens teeth and makes them more resistant to cavities. So that's why we put fluoride in toothpaste. That's why when you see your dentist, they will put fluoride on your teeth, especially children. It's very, very imperative that they get fluoride exposure, because it's a public health issue. Exposure to fluoride prevents cavities. It's just proven. Now, fluoride has some controversy surrounding it because anything good can be bad in too high of quantities. So you may hear people talking about, well, I don't want fluoride in my toothpaste. I want fluoride free. It's because at too high of quantities, fluoride can be bad. But in the quantity in the normal everyday toothpaste, it's very healthy. It's very good. I encourage you to make sure that your toothpaste has fluoride. It should say it on the packaging. I want to encourage you to make sure of that you're getting fluoride when you go to your dentist. But just don't let your kids be putting a bunch of toothpaste on their toothbrush. Don't be putting the regular amount for an infant. That's how you control the fluoride exposure. So brushing should be twice a day. First thing in the morning when you wake up, last thing at night. Make sure your kids understand that from 6 months of age. I want to kind of go into this a little bit more. So in that age, infancy on up to toddler, they're not going to like it. They're not going to enjoy this. It's not always going to be pleasant. You may have to fight. You may have to find a position comfortable enough for them, but the child may fight back. The child may push the toothbrush out. I don't want that to be the reason you don't do it. I talk to parents and they're like, well, they don't let me, so I don't do it. I just had a patient recently. The child is maybe 2, has cavities already. She's like, well, she doesn't let me brush her teeth, so I just don't do it as much. That's not going to be the reason. That to me is neglect because the child doesn't know better. You have to do this because otherwise we will talk about what can happen without this. Flossing once per day. Floss, for those who don't know, we should all know, but hopefully if you don't, it's the dental string that you use to go in between your teeth and clean them. Now, obviously with kids, it's going to be hard to floss and you don't really need to floss a baby's teeth. Flossing, comes in play when once they have majority of their baby teeth and the teeth are touching, then you can then floss in between. If there's all open and gaps, you don't have to floss because nothing is getting stuck. But as soon as teeth are touching, depending on how your child's teeth have come in, that's when you want to floss 1 time per day. Down and up between. You can kind of curve it as well. Adequate fluoride exposure, which I talked about, that's mainly in your toothpaste. It's also in dental. Dentists can also apply it. When you go to dentist, your hygienist can apply it. Also in drinking water, tap water has fluoride. If you're drinking it, a majority of us are not, if we're just drinking bottled water or filtered water. But if for whatever reason you're able to get decent tap water, that is also going to have fluoride. And speaking of water, you want to make sure your kids are drinking a lot of water. So starting around 6 months, when they can start solids, they can start water. Go ahead and introduce it at that time. Just something they can kind of sip on between meals or after solids. You want to develop that habit. Many parents have the mistake of giving their children juice, even soda. I'm sure most of us aren't doing that often, but making that something that the child becomes accustomed to, a sweet drink. We don't want that. We want those type of things to be treats on occasion, maybe for a birthday party or some sort of holiday, but not on a day-to-day basis, just drinking juice. They need to get used to water. Again, habits start early. So there's patients of mine like, oh, well, growing up, we always drank soda. Like we always just drank soda in my household every day. And so I always drink soda, mouthful of cavities, because soda is full of a lot of sugar. Most juices are also, depends on what kind of juice you're talking about. So you want to make sure your child is drinking a lot of water. So we've talked about what we can do to prevent dental issues, how to take care of our teeth. I do want to go a little bit into what can happen if things go wrong. What can happen if the hygiene is not adequate or the diet is also poor? So there's something called a cavity or caries, dental cavity, dental caries. So as you can see here, it appears like a black hole or a stain or just an open area. That's exactly what it is. So all of our teeth and all of our mouths have bacteria. There's good bacteria and bad bacteria. We're always trying to keep the ratio of bad bacteria low and good bacteria high. But what happens, what can shift it? What can shift it is the presence of sugar in our diet or acidic foods in our diet. We consume a lot of sugar and it sits on our teeth over time. It kind of interacts with the bacteria to produce acidic byproducts and it breaks down the tooth structure. This is gradual, but it can happen. It does happen. And you get a cavity. Maybe you notice there's a dark area on your tooth, or maybe you notice that on your child's mouth. Maybe you don't notice anything. It's possible that it's a cavity that's underneath the surface that only a dentist will see on the x-ray. So this is what happens over time. This is why we have to take care of our teeth, because this is what can happen. Now, you may not feel anything at all. Patients always ask me, well, I don't have any pain, so how is it possible? It's not going to always be painful. The pain depends on the depth. If it's deep, it's going to be painful. If it's not deep, you might not feel anything. The only way to fix it at this point is to have a dentist fill it, clean it and fill it. You don't want that for your child. As much as you don't want that for yourself, you don't want it for your child, because it's harder. It's much harder to manage, in my opinion, because I treat children and adults. And with an adult, at least I can explain it and they can kind of understand, and I can tell them, okay, so I'm going to numb your mouth. I'm doing this, this, and this. A child, you can't use normal terms. You have to really like distract them. They may have to use laughing gas or sedation. The younger the child, the more likely you have to put them to sleep. It's very hard to do these procedures in kids. And you also don't want to traumatize the child. Sometimes when children have an extensive history of dental treatment early, these are the same people who later on are like, I don't like the dentist, I had a bad experience. But it's also because there was neglect of your mouth early on and you needed more treatment, right? So another way to keep your child have a positive view of the dentist is if they only see a dentist for cleaning, because they never need cavities filled. So dental cavity, this is what happens, and it will need to be filled. Okay, so this is a picture in the mouth to kind of give you an example. Hopefully I'm not grossing anyone out. I have some grosser pictures coming up, but the point is to give you a visual, because people don't understand sometimes that it looks different ways. The cavity is the dark area, also on the outside of some of these front teeth, those are cavities too. Okay, and so this is the causes, the sugars in the diet, and also cavity causing bacteria that actually produce acidic byproduct. When I want to talk about acid, I don't want to get too scientific, but the pH of your mouth is important, and there's certain things that shift it toward the acidic scale. Soda, I believe coffee, I'm trying to think. There's a lot of things that are very just acidic, and they shift the pH of your mouth down and make it more prone to cavities. So the other thing you want to think about is it's the frequency of duration of sugar intake. So let's say you allow your child to have candy at a friend's birthday party, and this is something that maybe happens once or a couple times a year, versus like this child is eating candy every week. There's a big difference there, right? The frequency. And then the duration. So let's say you drink a little bit of juice with a meal, and then you drink water and you kind of move on, and that was the only juice today, versus you had juice in a sippy cup and the child drank the sippy cup all day, every hour taking sips. That means you're constantly shifting the pH of your mouth toward acidic. That means you're constantly exposing your mouth to the sugar. There's a difference. The frequency and duration is really the issue. So that's why I say once in a while, sometimes once here and there, I drink water to flush it, is different from constant use. The most common disease in childhood is dental cavity, dental decay, 5 times more common than asthma. It is a legitimate public health issue. And so that's why prevention is better than cure. We're talking about how to brush our teeth. We're talking about how to keep them clean. We're talking about habits that start early, because guess what? Starting the habit early is better than having to figure it out later. So these are some of the reasons why we get cavities. And this is just a picture of the progression. Normal, healthy, it starts as a white chalky spot. So if you see an area of your tooth that looks very chalky and white, it could be starting. Brown spots, and then severe. What they've shown here as severe is definitely very severe, especially for pediatrics. We don't see this all the time, but we do see it. This to me looks like somebody who was drinking soda every day and candy, or at least frequently, right? So most of us will not see this severe in our children, but the level 2, level 3 here, this is more common. And again, you may not see anything at all. Your child's 2 teeth might look normal and healthy to you, but the dentist says, oh, they have 2 cavities, because sometimes they're under the surface. So we definitely want to work on prevention. Okay, sorry. Okay, so hold on a second here. I'm trying to move this bar out of the way. So I want to talk about visiting the dentist. So people are always going to ask, when do you need to go? So American Academy of Pediatrics, funny enough, does recommend 6 months old. So to most people, it's like, that's crazy, that's a baby. But that's actually the recommendation. And the reason is because at that point you have teeth, or you're about to have teeth. But I would say at least by age 1, by age 1, dentist for your child. Why? Because we're going to do prevention. We're going to check things early. We catch things early. make sure everything looks good, get them used to the concept of visiting the dentist, make them comfortable with that visit, and just making this a regular part of life. And so there are pediatric dentists and there are general dentists. You can see either. So pediatric is specifically geared toward kids. I would actually recommend that as the first line, just because they have just the most expertise and all of that. But it's going to depend on the availability in your local area and your insurance, maybe access. So there are many general dentists who also see kids. I, for one, do see children, even babies, in the practice I'm in. So dental home by age 1. It's just important to set the stage. It really helps. Preventive care, we're going to clean their teeth better than you can at home. Just kind of reset them, just like as an adult, you can get a cleaning. Theirs is much more simple, but it's still something and it's helpful. We're going to examine their teeth. We may take x-rays if they're almost 2 or 3, right? We're going to look at things very detailed and critically in a way that perhaps you would not be able to at home. And we're going to provide something called anticipatory guidance, which is what we discuss in pediatric dentistry, where we're talking to you as a parent, actually, about nutrition, about oral health of your own oral health, about childproof and preventing trauma, about hygiene. I like to talk to my patients' parents about their diets. I like to talk to them about their habits. What are they doing at home? And this is where some of these things come out, that some of these parents are not doing the right things. For example, I'm going to tell you, you should be helping your child brush until they can write their name. Again, you should be helping your child brush until they can write their name confidently. So you have a 4-year-old at home who seems very confident and appears to brush decently well. You should still be helping them brush. They brush, then you brush again. Why? Because they're not as thorough as they could be until the dexterity of their hand can hold a pencil and write their name. So these are the things that we will be teaching you about when you're coming in and you're bringing your child in. Extremely important, extremely helpful to have these conversations with the dentist to prevent this. And just to kind of explain, in this picture, you see a little girl sitting in a chair. She could be maybe 3, 4, or 5, somewhere around that. So she's in the chair. But when we have the children who are under 2, sometimes even under 3, we do what's called a knee-to-knee exam. So imagine an infant obviously could not sit in this chair. A 1-year-old could not sit in this chair. So my knees are to the parent's knees, and the child puts their legs around the parent and leans their head back into my lap. And it makes it just more easy, like mommy or daddy is right there. You're not on your own. And they get used to it. I mean, I've seen it I've seen it in practice. Some of these kids are, fussy, uncomfortable initially, but with time they become comfortable because it's like, okay, I know I'm going to be here every 6 months, every 3 months. I'm just going to get used to it. So again, visiting the dentist young, it creates good habits. It prevents dental anxiety. It educates the child, helps the child feel comfortable, and shows the child that this is actually very important. And this is something that they should be prioritizing when they grow up as well. And it just makes it a normal part of their life. What are we doing when they come? What are we actually doing? It seems like there's not much to do because these are baby teeth, but no, there is. So we're going to do a cleaning. As I mentioned, the cleaning is a little bit more simple, perhaps much quicker than your own cleaning because they don't have as much buildup of plaque or calculus. We're going to do fluoride, which I explained. Fluoride is a vitamin, a mineral that is very, very healthy and good for teeth, but it needs to be applied topically. So we're going to apply it. It's real sticky, and we'll probably tell you can't eat for 30 minutes. So we're going to apply fluoride in a topical form on their teeth. Other things, sealants, fillings, stainless steel crowns, base maintainer. I'm going to show pictures and explain. Sealant. So at the bottom left, we see a regular tooth. This is actually a healthy tooth. There's nothing wrong with it. You see some grooves on the tooth. We just call those grooves fissures, pits. So what that is just naturally this person's anatomy, their natural dental anatomy is with deep grooves. What does that mean? When you eat anything sticky, it sticks inside. Eat anything that can just adhere to the tooth, it adheres into the groove. So we go in there and do what's called a sealant. A sealant is just a liquid resin material that we place into these grooves, and we use a light to harden it. What does that mean? That means that tooth is now resistant to cavities forming in the pits and fissures. And so this is a huge, huge, huge thing we do in pediatric dentistry. Matter of fact, the recommendation is every child, every molar, every posterior tooth, right? Molar children, when they become a little older, they'll have premolars. Just recommending this regardless because it's prevention is better than cure. So again, what is it? It just means that we're filling these deep grooves in order that food can't get stuck. Filling. Next picture, we see some dark areas that are cavities, and you see in the following picture, you don't see them anymore. What we did as a dentist is we use our high-speed handpiece, or what we call the drill, and we clean it, and we fill it with a resin material that is tooth-like, that bonds to the tooth, that restores the tooth. So that's a filling. Filling is for cavities. We talked about cavities earlier. So sealant was not for cavities. So once there's breakdown of tooth structure, you have either a hole or may not be visible, or maybe it may be underneath the tooth, inside the tooth, wherever it is, however we diagnose it, either by visual examination or by x-ray. As a dentist, I will diagnose it, then I'll treat it. And this is the treatment. It's to clean it, take out the infection, take out the decay, and to fill it. And the filling is something that should last a lifetime, but it is also prone to getting a new cavity if you don't keep it clean. So that's something that happened that you need a second. It's something that will last a lifetime if all things considered. So in order to do that, we do have to numb you, local anesthetic with a needle. So again, in adults, obviously also not comfortable, but we can explain it. In kids, we have to go through all sorts of explanations. I have to call it sleepy juice. I have to, just really distract them, do all sorts of stuff. So it's a lot to go through for a child. So it's better that we just keep their teeth clean and not have this issue. Now, this is not to say you can't do everything right and your child will have a cavity. It is possible, right? If any sort of sugar exposure, it can happen. But we're trying to minimize it. And hopefully it's not going to be a regular occurrence that they're needing fillings all throughout childhood. So that's sealant, that's filling. Now, I just put these other as for your information. Stainless steel crown. So you see that the tooth is now silver. So stainless steel crown, or let me just say crown in general, is where we cover the entire tooth. We don't just fill a part of it, we cover the entire tooth. So why would we need to do that? A crown means that you have a big cavity, or maybe part of the tooth broke, a lot of the tooth broke, or the cavity is big. So you can't just fill it. It's so extensive. You have to do something to prevent that tooth from breaking or having more deeper infection. So most of the time, stainless steel crown is a child who has a cavity that's very deep. That's the best way to explain it. Your child may even have a toothache, in which case they need an additional procedure called a pulpotomy. But if your child presents with toothache or a tooth that has broken, we mostly do stainless steel crowns. We do have tooth colored crowns, but the stainless steel is just more simple for kids because of the nature of the baby tooth anatomy and the fact that the tooth will be lost. As an adult, however, if you need a crown, your crown is going to be tooth colored and it's going to be made out of a different material. But mostly for kids, if you look at a kid's mouth and you see silver teeth, it's a stainless steel crown. It was a large cavity that was extensive, probably deep into the tooth. And it's just easier because when we do the stainless steel crowns, because of the properties, we can just shave around the tooth a little bit and we bend the crown a little bit and cement it on. It makes more sense. Hopefully your children will not need these. This means the cavity is extensive. Space maintainer. So as I mentioned, teeth are coming out in sequence. You don't want to lose a front tooth at age, let's say age 4, and have to wait until age 8 or 9 to get a front tooth back. You don't want to lose a certain tooth and have a gap for so long and all these things. So this is what happens. If a tooth is lost too early, we create this appliance to hold the space for the adult tooth. Otherwise, teeth are always shifting. If there's an opening, they'll shift, they'll close. If there's a tooth missing here, the other tooth could come down, especially baby teeth, they can shift. So this appliance is going to hold space. Not something that's used all the time. You will most likely not, child will not need this, but it's just for your information that also exists. Briefly touching on non-nutritive sucking habits. So most babies have a desire to suck something that is satisfied with breastfeeding for some season. It's also satisfied with pacifier. It can be satisfied with a digit finger, thumb, index finger. Pretty much a normal reflex around age 1 to from birth to 2. So up to age 2, that's pretty normal that they want that. So for a little baby, you can give them pacifier. That is fine. Around age 1 to 2, I'm giving a wide range, but somewhere in your age 1 year, you want to slowly discourage pacifier use. That could be right at the first birthday. That could be at 1.5. That could be at 2. That could be your deadline, right? But somewhere around there, you want to discourage it. Same with thumb sucking. Thumb sucking, we don't want it all, but if they're doing it, many kids will just stop. But by age 2, you're like, okay, we need to stop. And then there's obviously some kids who will linger with this and continue to try. But the hard and fast cutoff is like 3 to 4. That's when it's like, y'all shouldn't be sucking anything, your finger or your pacifier. Why? Because it does affect the position of your teeth. As you see here, you're going to lead to an anterior open bite, whereas you want your teeth to be closed when you close. But these people, when they close, their teeth are still open. It's an open bite, right? So it's going to affect your teeth. And even though they're baby teeth, it's setting the stage for the permanent. So the permanent are going to try to erupt similarly. And then as you're getting past 3 or 4, you're getting into the stage of like where you're going to lose your front teeth and get adult ones. Imagine you're still sucking your thumb at age 6, you're really going to mess up your adult teeth. So with these habits, you want to discourage it. I said here, consider corrective measures. So corrective measures could be cutting the pacifier, throwing it away, hiding it, showing the child that it's been buried. I'm now seeing, because I'm dealing with this with my own child, there's books that like, oh, no more pacifier, I'm a big boy. Like there's books, there's all sorts of resources, right? And then when it's a finger, you can use a mitten. They sell mittens. You can go on Amazon, thumb sucking mitten. You can use a nail polish. It's clear. It's not really nail polish. It's just a clear thing you paint on their nails to basically make it taste bad. So every time they put their finger in the mouth, it tastes bad. But you really want to move towards leaving these habits behind, especially when you have like, we're talking 3-year-old, 4-year-old. That's where it's like, this really has to stop. 1 and 2, we do want to stop it, but it's not as, critical. But getting to 3, 4, you're still doing it, you want to stop it. This is where your pediatric dentist or your general dentist can partner with you to make those decisions on how to time that. Your dentist is always going to encourage you to stop it. And I know as a parent, it's hard because, again, I'm going through it. As a parent, it's hard depending on the way that your child relates to that. I know for some, it's like a sleep aid. For some, it's just getting through the night. But again, infancy, that's fine. But once you're over age 1, that's where we have to really think it through. And another way to do it is tapering it off. So, there's some kids who are sucking their pacifier all day, which is a problem because they're trying to talk. They can't even talk to the pacifier. And they're trying to learn first words, say mama, dada, but they have pacifier. So what you can do at that point is like reduce it to where it's like nap time and bedtime. Okay. And then cut out the nap. Oh, it's only for bedtime. And then gradually it's like, oh no, we don't need it at bedtime. We're big boy. We don't need pacifier. So there's ways to taper it down. It doesn't have to be cold turkey, but it can also be cold turkey if you want. It's really up to you how you want to do that. So that is the extent of my PowerPoint. I tried to cover a few different aspects of pediatric oral health. Hopefully I made a compelling argument for why it's important to take care of your children's teeth. But I believe if we have time, we might take a couple questions if there are any, but if not, thank you so much for your time. And I hope you all have a good evening.
Amen. Amen.
Thank you so much, Dr. Autry, for this insightful presentation today. I've learned a lot, and I know our audience are also like learning so much from this. Well, before we even open up the floor for the questions, just to remind us that we have a dental fair coming up this Sabbath. So whilst we're getting the lessons online, we're also having the practical stuff on Sabbath. So make sure to bring a friend or tell your friend's friend or your family to bring their kids around. So we're going to have a free dental screening for the kids. Now, without much ado, please, if you have any question or contributions to this presentation, please raise your hand and we're going to call you so you can ask your question. Thank you. Now, whilst we wait, Doc, whilst we wait for the questions, I have my questions I want to just jump on and ask. So, so from being an immigrant, from where I'm from, sometimes there's a question about hard brush versus soft brush. What's your pick on that, and how does it affect how teeth quality is?
That's a great question. I do get that question a lot. So it's a misconception that hard is better. I have to tell people that because if a tooth and the teeth, especially if the toothbrush is very hard and you're brushing hard. So generally speaking, we actually recommend medium or soft. Now, soft for some people, they don't feel like their teeth are clean. So I think medium is a good happy medium. When you're buying your toothbrush, you'll see that it's labeled soft, medium, or hard. I recommend medium, and I recommend you do apply pressure, but not too much pressure, because if not, it can actually kind of cause your gums to recede or cause, we call it toothbrush trauma in dentistry. So it can cause some trauma to the tissues if it's not too hard. So you want to concentrate on brushing thoroughly, not necessarily hard.
Thank you so much. I think we have some questions in the chat. I'm gonna go ahead and read out some of them. One question from an iPhone user saying, does chewing gum affect the teeth in any way, good or bad?
Okay, that's a good question. So it can. So just generally speaking, the first thing is you want to know, make sure the make sure that the gum is sugar free. A lot of the ones we do use are, but you want to make sure it is. So, but if it's not sugar